my name is Jess, and I'm an OT here in our brick office, and I am here with our patient, Megan. Megan is here because she has swelling in her hands following a radial fracture. And so what we're here to talk about today is swelling management and why that's important. So swelling happens when fluid gets stuck or gets trapped in the space in between our skin and our muscles, and it stays there. It has trouble draining. We have a system in our body called the lymphatic system that helps drain all of that fluid, but sometimes it just doesn't kind of get it quite so quickly. And so what the lymphatic system is just a series of vessels and valves that bring the fluid closer to the heart, and it dumps it back out into the circulatory system. So when you have swelling, the fluid's not moving, and it can lead to decreased circulation, pain, stiffness in the joints, and it can discomfort and can put you at an increased risk for scarring and other comorbidities. So it is something that's really important to take care of, and that's what we're going to walk you through today. Okay, so one of the things when we're talking about swelling is that people might talk to you about a RICE protocol. RICE stands for rest, ice, compression, and elevation. So we want to rest the area. You don't want to re-injure it, especially if it's coming off of an injury. So if you rolled your ankle or something like that, we wouldn't want to risk you rolling it again and making the injury worse. Ice is important because heat can actually exacerbate swelling and make it worse. So that will help bring the swelling down. Compression is important because it helps move all of the fluid out of the area and back into your lymphatic system so that it can drain effectively. And elevation helps with drainage. So when we're talking about the elevation, let me see your hand. Even if you could just kind of keeping your hands up above your heart, or the swollen area up above your heart in some way, is important. So even if you're just kind of at rest and you can keep your hand up for a little bit, that just helps everything drain just a little bit more effectively. When we're talking about compression, there are a couple ways that we can do it. There are compression wraps, but there are also different compression garments that you can use. Sometimes, very commonly, people will see compression stockings, and they're used for a variety of different conditions. For the hand, we have different compression gloves that will help, again, keep everything moving in that area and help everything drain effectively. So there are a couple of different things that we can use to keep the fluid moving. There are, depending on the area, different exercises you can do to pump the blood. So in the hand, something that I would have her do is just periodically make a fist, squeeze it tight, and relax. And just pump that a few times, and that can help keep the fluid moving. Another thing that I would do, a manual technique that we use, is called retrograde massage. So you take, it's in the area, a little bit of lotion, and you start further away from the heart, and in long, firm strokes, you push towards the heart. And so that just helps move all of the fluid through your lymphatic system and gets it circulating again. So lastly, something that we can do is we can actually use Kinesio tape to help passively with drainage. So what we do is we cut a piece of Kinesio tape into 4 strips, and we apply it in a basket weave kind of pattern while you're in a flexed position. And what that does, and what it will do, is when she extends her wrist, there will be ripples in her skin. And these ripples help lift the skin and they help allow fluid to enter into our lymphatic system. So it looks a little complicated, it's pretty simple. And you can wear this for as long as it is tolerated or as long as it stays on. Depending on where the tape is, can make its wear time variable. So straighten your leg over side for me. So how it has all of those bumps in there, that's lifting the skin, and that's allowing for better drainage of any swelling and any fluid trapped in there. And that was my video on swelling management. Thank you for watching, thank you for listening. And if you have any questions about anything like that, please feel free to visit us at any of our Thompson Healthcare locations. Thank you.